Mhm.
Okay, everybody, welcome to the Healthy Joints, Healthy Lifestyle Show. And I have a treat for you today because I have one of my dearest friends, Dr. Bode Akinsanya. So, Dr. Bode is a family practice physician in the Bellevue, Greater Seattle area. He practices for Overlake Hospital. And I'll tell you, he is one of the nicest and the smartest primary care doctors that we have in town. And so Dr. Body and I have a number of patients. Even my husband, personal information here, is a patient of Dr. Body. So you know he's one of the best of the best. So Dr. Body's family practice specialist is in Issaquah, Washington, but Greater Seattle area. He graduated from Obafemi Awolowo College in Nigeria, and he also had worked with St. Francis Hospital and St. Joseph Medical Center, and currently works with Overlake Medical Center and Clinics. And he did his residency back in Sparrow Hospital. So Dr. Bode Akinsanya's medical training and compassionate has a medical training that focuses on a compassionate approach. He offers personalized healthcare solutions tailored to each person's unique needs, and I'll tell you that is a fact. In fact, but didn't you take care of me one time that I hit my ribs? I think you did.
Hey,
Yes,
yeah,
yes,
yes, I am.
yeah. Yes. So anyway, so I'm going to let Dr. Bode introduce himself, and then we are going to get into the meat of some very important questions that patients ask us all the time. So you're in for a treat.
Hello, everyone. My name is Bode Akinsanya. I think Dr. Dada has said a whole lot about me. Uh, Originally from Nigeria, practicing here on the Seattle East Side area of Issaquah. I work with Overlake, and I'm a family physician. I'm a Liverpool fan. I know that's important to my Liverpool fans out there. I love what I do. I love seeing patients. Um, it's very fulfilling for me to see and help people in their medical journey. And yeah, and Dr. Dada is one of my senior colleagues in the area, and it's a pleasure being here.
Well, we're so happy you made time because Dr. Body was very busy in clinic today. So I'm glad he made time to spend with us. So we are going to dive right in. And so one of the things that I'm always trying to convince my patients to do is to make sure that they're getting their annual physical exam, right? And so, Dr. Body, can you kind of tell our listeners here, what are the primary goals? What's the benefit of even doing this annual physical exam? And why bother? And does it differ with the different age groups?
So the annual physical exams, these are preventive visits. These are visits where, nothing has to be wrong. When it comes to office visits, you have the problem visits and the preventive visits. The preventive visits, just like the name, is, you're just kind of like checking and making sure, things are working and everything's right and nothing is brewing without you not knowing. And and also, annual physical could mean different things to different people, but pretty much it's the preventative visits. In the past, we used to have what we call meet and greets, uh, but we no longer have meet and greets where when people are starting off with a new primary care physician, they just come in, say hello, and bye. But now we have, annual physical visits where we can use it to one, introduce you to the healthcare system. Some people have not had doctors for many years, and that will serve as a gateway or entry point for them to plug in their health. And that way we use it to establish their baseline and understanding where they, what their journey is. And based off of age, we would use that to offer preventative services to them. Also, during this annual physical exams, we use it as a time to catch up on vaccinations. And like you also know, vaccinations are, preventative services, making sure that you do not develop illness. So yeah, so in a nutshell, a preventive or annual physical is a visit where your doctor gets to, one, could meet you, to establish a baseline for your health, three, ensure that you're reaching all your age appropriate screenings.
Yeah. Okay.
That's what we try to achieve in those visits.
Okay. And so when you say baseline, I wonder if that means different things to different people, right? In my world, I get x-rays of people's hands at baseline. What's the baseline kind of, when you're getting that annual physical? Are there specific things that we're thinking about and looking for?
So oftentimes this is age dependent, and
Yeah.
for children, being a family physician, I see a broad spectrum of people, from cradle all the way to the geriatric population. So for children, that would be something like what we call the well child visits. For
Yeah.
adults, wellness. For the older Medicare patients, that might be their Medicare wellness exams. And then for the middle age, it is annual physical or routine physical, as the name implies. And when we talk about baseline, we just order, typically based off of the age. We
Yeah.
order routine labs, things like checking if you're a complete blood panel, which looks at your blood counts, making sure your blood count is fine. Ordering something like the complete comprehensive metabolic panel, which looks at your liver, kidney,
Yeah.
electrolytes like sodium, potassium, all the electrolytes in the body, and also your liver function. And again, based off of age, we also order specific tests or screening modalities.
Yeah.
So
So let me ask, so, and the age for screening for colonoscopy changed, right? I said that it changed because, Black Panther died. But did the age of colonoscopy screening, the age that we recommend people get a colonoscopy, did that change recently in the last
yeah,
decade?
yeah. So we used to get this done at age 50,
Yeah.
and for people who are low risk. And then again, depending on your risk, that's why it's important. It's not a one size fits all. So if you have a family history of colon cancer, then you fall into a different category or a different screening group. At that point, we have to listen to you, know when that family member, that first degree relative, developed colon cancer, and then we
Yeah.
screen you at an interval different from that of the general population. So
Yeah.
initially, this used to be age 50 for the
Yeah.
general population slash low risk, and then
Yeah.
this was now changed to age 45.
Yeah. Okay. Okay. So everybody out there, 45 is, 45 is the new age at which you need to get your colonoscopy done, because that's still preventable, right? It's always sad when you find somebody with colon cancer that's actually more advanced, especially when it typically is something that, if was caught early, could be treated.
Mhm.
Yeah. Yeah.
Yep. Yeah.
Okay.
Yeah.
Let me ask a few questions. Okay, what age should people get their mammograms done?
With mammograms again, women age 40 and
Okay.
above. But then it also depends on risk factors too, right? If a woman has got a lump in her breast, regardless of age, she should get evaluated. She should get, checked out, and then whatever we have to do, be it an ultrasound
Yeah.
or a mammogram or a diagnostic mammogram. If she's having any breast symptoms, she should get it checked out, because
Okay.
that's also another form of cancer that can be, caught early, treated,
Potentially. Yeah.
and yeah,
Okay.
yeah.
Okay. So while I'm on this path, what about pap smears? When should women get pap smears?
Pap smears starting at age 21.
Okay.
Uh, and And one of the things, pap smear is prevention of cervical cancer.
Yes.
And one of the things that can set the stage to prevent that early on also is the HPV vaccine,
Yeah.
which yeah female, both male and female should get when they're much younger. So if they have been coming in for their well child
And
visits, it's one of
yeah.
those things where we would let them know. For boys, it prevents genital warts,
Yes.
while in female, prevention of cervical cancer.
Okay. Okay. And then
And
I'm
also,
gonna
just
just
just to
yeah.
just to throw it in there,
Yeah.
at this annual physical visits as well, we also, it's not just about ordering tests, right? It's also
Yes.
about talking about how to lead a better lifestyle. We talk about
Yes.
your diet, we talk about lifestyle modification in order for
Yeah.
you to be the best version of yourself.
Yeah.
So diet,
Yeah.
you talk about your sleep, if you smoke, smoking cessation and
Yeah.
things like that.
So, so it sounds like, so it's not just, okay, you're going to go in and they're going to order a bunch of tests. It's really an opportunity to really analyze kind of the way you're living your life and whether
Mhm.
there are things that can be tweaked a little bit, perhaps, so that you can have basically become a better version of yourself, at least a healthier version of yourself with some guidance, right?
Yes, exactly.
Yeah. Okay.
Exactly. Hmm.
Yeah. So yeah, because a lot of people say, well, I just have, but sometimes some docs, some patients, like, well, my primary care doctor is just gonna, just order the test for me. And I'm gonna say, the visit with the primary care doctor is more holistic. It's not just, oh, they're just gonna order my cholesterol and my thyroid, right? It's really more,
Hmm.
what would you say to those patients who just say, well, all they're gonna do is order my thyroid and check my cholesterol, right?
So, my personal approach to these physicals, when I see a patient coming in for a physical, one of the things that I have I have I have things that guide my visit, and one of these things is, one, I want to have an idea of what this person's physical activity looks like. Now, not only when I ask you those questions, it's not only me asking to know, sometimes it serves as a reminder for my patients to know what they should be doing. So,
Yeah.
asking them about, what's your level of physical activity? What do you do for exercise? Some, at that point, some people have a light bulb moment. Oh, I don't do anything. What should I be doing? I ask about their diet. What does your diet look like? Tell me, what's your typical breakfast like, lunch, dinner? How do you apportion your meals and all of that? I talk to them about their vision. Like, okay, how's your vision? How do you rate it? What do you think? When was your last eye exam? Have you had an eye exam? If yes, when was the last one? I talk to them about their dental health, because we cannot neglect this either. You know, um, the dentist will say your teeth is a representation of your entire
Yeah. Yeah.
body.
Yeah.
So want to make sure that, because these are things that we have busy lives, and me just posing that question to you serves as a reminder, like, oh,
And
I've not
the
had that done.
trigger. Yeah.
Yeah, as a trigger, like, oh, yeah, I think I need to set that up. And then
All
I
right.
talk about bowel patterns.
Yeah.
What's your bowel pattern like? Because colon cancer is fast becoming one of the very common cancers we're seeing. And you'll be surprised that people don't know that, or they're not aware that their bowel habits is changing. If you find a
Oh, I think we had
colon
an
cancer,
okay.
or
Yeah. I lost you for a minute there. Sorry. So you were saying, you were talking about how when the bowel habits change, sometimes
yeah,
people have not paid attention, and then I lost you for a little bit.
that could be a sign of colon cancer itself. So,
Yeah.
just making people attuned to that
Mm.
let us know if you're having any changes to that. And then for females, you want to talk about their mammograms, you want to talk about any changes in their menstrual patterns as well. you
Yeah.
know um And then one issue where oftentimes when people come in for a physical that they really wanna they it's just because they don't know how to break the glass or navigate it is sexual function.
Yeah.
You know, oftentimes people come in and say, "Oh, I want to have everything checked." You know, what does everything mean? You know,
But yeah,
they have
yeah,
the underlying, but as you know, as someone who's trying to be more holistic and checking everything, you know,
yeah,
sexual life is also very important. So, you know, just bringing that to the forefront.
yeah.
And then lastly, you know, I ask about sleep, you know,
Yes.
which is, you know, very, very important to one's mental health.
Yeah, yeah, yeah. A lot of people that have chronic fatigue, a lot of what we're talking about too, when they're like, well, they can't concentrate. So I totally agree with you that the sleep is really a big function of, even your mental health and your body's health, right? And sometimes people have fibromyalgia because they have poor sleep hygiene and maybe they have some sleep apnea. But yeah, so thank you for kind of giving kind of a more of a holistic. So sometimes they feel like you're just talking, but you're actually asking really critical questions that if it's a positive response, then requires kind of more of a deeper dive, and then trying to figure out, why is this patient really here today, right? And
Hmm.
sometimes it takes a couple of visits for the patient to actually start to kind of loosen up, and sometimes they take those suggestions home and they now pay attention to their bowel habits and they realize, wait a minute, this poop is black, not supposed to be
Hmm.
black, right? So
Yep, yep.
yeah. So can you give us, I mean, I think we've kind of insinuated what can happen if we don't keep some of these annual physical exams. We kind of we've hinted at it, but yeah, tell us a little bit more about what can happen if we keep skipping them.
Yeah, so if you keep skipping them, a few things is one, nothing might happen. You know, you could
Yeah,
just be a healthy person
yeah,
who's fortunate,
yeah,
and then skipping them could mean, you know, having conditions where you're not aware, and screening which can be, you know, taken care of early on. Changes in your body that, you know, has not yet manifest to the external or the
yeah,
exterior,
yeah,
and one way is, you know, to catch it early, you know, coming in for those physicals.
yeah.
Yeah.
Yeah, yeah. And some of those
So
things that, yeah, and people can really tolerate. I guess, part of what you're saying is that it's interesting how people can tolerate quite a bit, right? People can tolerate quite a
yeah.
bit. They try to function, they have a lot of fatigue, but they're still struggling, they're still functioning. They're doing everything that they can do, because a lot of our patients are really heroes. They're working so hard, trying to manage this thing on their own. Meanwhile, their thyroid is what's slow, right? But they're just kind of pushing
Hmm.
through, right? And maybe an easy
Right.
fix, right? Or maybe even something like, they have diabetes, they don't know, right? And
Hmm.
maybe some dietary modification can really help improve some of that, in addition to medication, of course, if they already have diabetes, but maybe they're pre-diabetic, right? And they haven't quite tipped over. But maybe some counseling may help them in terms of what food choices they want to make, right? So
Right.
yeah, so a lot of that kind of overlaps into some of the conditions that we treat too. So Dr. Bode, I know you have lots of examples of kind of patients that you've helped on their journeys. And can you give an example of kind of someone who you've worked with or worked alongside with that has had, we'll talk about good outcome.
um you know, oftentimes you know, people have their personal struggles, and these struggles, you know, have a wide variety, you know, from smoking to even weight management. And it's just because sometimes there's so much information out there, and it's hard for people to individually distill that information for their personal use. And you know, I've had situations where you know, people have tried, you know, different modalities, different things to help you know, with some of these struggles. And And again, not necessarily from their physicals, but the physicals, those initial introductions was able to help them warm up and warm up to me and let them agree to some of my recommendations.
Yeah.
And in the world we live in today, where we have, there's a lot of stress out there, there's a lot of anxiety, a lot of
Yes.
depression. And
Yeah.
I've seen this. There was a situation where a patient came in and, without saying too much, um, felt they had a cardiac issue.
Yeah.
And upon talking more, this was more about anxiety and depression rather than anything. Just having to give this patient the PHQ-9, which is a screening tool we use for depression, and the
Anxiety.
GAD-7, which we use for anxiety. And
Yeah.
once she started filling that out, she realized that, wow, everything she was filling out was all the way on the side of, severe anxiety and depression. And, she was coming in thinking she needed to see a cardiologist,
Yes.
not knowing that, because she's having like fast heart rate.
Yeah.
She felt like her heart was skipping and
Yeah.
all of that. So, we've had situations like that where, you just have to,
Oh,
like, listen to the person's story, know where they're
yeah.
coming from, and then, apply what your
Yeah.
clinical judgments to that situation.
Yeah. Yeah, I mean, that so totally makes sense. So patient comes in kind of thinking, hey, I have a cardiac issue, I'm having palpitations all the time. But this patient has been coping with quite a bit, and then I think when you
Mhm.
apply the forms, the PHQ-9 as well as JD screening
7.
tools, yeah, and I think that's when kind of the real underlying issue that patient had been kind of struggling with actually came to the forefront. And those are the kind
Yeah.
of things that, because she could find herself in the ER or emergency room, right?
Mhm.
Where the ER and emergency room is really not the place where those conditions will get taken care of. They're there to treat you for heart
Yeah.
attacks, strokes, and stuff like that. And if you're not having those
And rule
issues,
out. Yeah.
yeah, rule
And rule
out.
out
Yeah.
those. Yeah.
Yeah, rule
Yeah.
out. They want to make sure you're not going to die in the next 30 minutes. So if there's
Yeah.
no impending doom, then they're not really set up to be able to manage things like anxiety and depression and stuff. And so those are other reasons
Right.
why people really need to kind of be in touch with their primary care doctor. Otherwise, ERs are very expensive places to get diagnosed with that. You get diagnosed of having a heart attack in the ER, but you don't want to get diagnosed with anxiety in the ER because that's a very, very expensive place to go get that
To get.
diagnosis made, right?
Yeah.
Right.
Yep.
So
Yeah.
yeah.
Yes.
So yeah, thank you. That's actually a very, very helpful story. Another reason why, we want to have you want to have your primary care, you want to be established with one. You want to make sure we want to make sure that we're keeping up with these annual physicals, and everything is fine until it's not, right? And
Hmm.
like you said, a lot of things are holistic. You get to your doctor, you kind of look at the holistic picture. It's not, oh, I'm coming in at 2 a.m. with a heart attack, with chest pain. There's a lot of opportunity way before then for that to have been diagnosed. And if you're, working, lock and step with your primary care doctor, then there's a lot that can be prevented, right?
Yep.
Is kind of what I'm gathering.
Yes.
Yeah.
Absolutely. Absolutely.
Well, it has been a pleasure, Dr. Bode Akinsanya. Thank you so much for taking time at the end of the day. For those who don't know me, my name is Dr. Arinola Dada, and this has been the Healthy Joints, Healthy Lifestyle Show. I was so excited to welcome Dr. Bode to the show, but I'm so glad that he took time at the end of his day to spend time with us. And so the best place to kind of find Dr. Bode Akinsanya, if you're in the greater Seattle area, he works with the Overlake Medical Clinics. Dr. Bode, how else can we find you?
On LinkedIn, and our office location is 5708 East Lake Sammamish Parkway Southeast, Issaquah. And I can be found online on my LinkedIn page, Olabode Akinsanya, MD.
Okay, perfect. I will put that information at the end of the show notes for anybody that wants to contact you. You're an amazing physician, and I'm so glad that you spent the
I
time
try. I
today.
try.
Yes, I know you try. I know you try. But
I
not only do
try.
you try, you do a phenomenal, you do a phenomenal job. And I'm so glad that we had the
Thank
time
you.
to have you on the show today. Well, thank you, everybody. Have a great night. Oh, don't forget to like this, share this with anybody that you think would benefit from watching. Okay, everybody, have a good night.
Yeah, thank you. Good night, everyone.